Welcome to MedX channel. Today we will continue to talk about medical terminology. Okay. Don't forget to like the video and subscribe the channel. Respiratory system structure and function. It is the system that enables the body to breathe. It is divided into upper and lower respiratory tract. Upper respiratory tract begin with nose, mouth, and the beginning of the trachea. Lower respiratory tract include the least of the trachea, bronchi, bronchiole, lungs. The organs of the lower respiratory are located in the chest cavity and protected by ribs, muscles, and between ribs there is a diaphragm. Those bones protect the lungs and heart from any injuries. There is trachea and the bronchi. The trachea connecting the throat to bronchi. In the bronchi, the trachea divides into two bronchi. One leads to the left lung and the other to the right lung. The bronchioles, the bronchi into small tubules that called bronchioles, and in the end pulmonary alveoli. Pulmonary alveoli, it is the least and the most tiny thing in the respiratory tract. This is the nasal cavity, and this is the pharynx, this is the epiglottis, this is the trachea, and this is the bronchus. This is the right lung, it has 3 lobes, and this is the left lung, it has 2 lobes. This is the pleural cavity, which is the thing that covers the whole lung, and this is the diaphragm. As we mentioned, atmosphere, external nostril, nasal passage, pharynx, larynx, trachea, bronchi, bronchioles, and the alveoli. Okay, respiratory tract system. Respiratory tract system, it is there is rhino, which means nose. So when we say rhinitis, there is inflammation of the nose. Laryngeo, it is mean larynx, which means voice box. When we do laryngotomy, it is an opening in the larynx, and laryngectomy, it is the removal of the whole larynx. Okay. Trachea, it means windpipe. So tracheotomy, it is an opening. Tracheostomy, it is an opening in the trachea. Tracheitis, it is inflammation of the trachea. Broncho means lung air. So bronchoscope, it means I will see what inside the lungs and the bronchiole. Pneumo means air. So tachypnea or dyspnea, it means decrease. This is increase in the respiratory rate, and this is decrease in breathing. Pneumonia means inflammation. It is not endoitis. It is called pneumonia. Okay. Ipsis means spitting. So hemoptysis, there is a spitting of the blood. Or, by the way, coughing of the blood. Okay. This is here the respiratory tract, trachea, bronchiole, bronchi. Okay, this. Okay, let's talk about the urinary function. Let's talk about structure and function. The kidney, Kidneys filters blood at the top of urinary system. Nephrons are the basic functional unit of the blood filtration and urine production. The ureter moves urine from the kidneys to the bladder. This is the kidneys, and this is the ureter, and this is the bladder. The urinary bladder acts as internal storage of the urine. The urinary system. The kidney do most of the work of the urinary system, while the other parts serve as a passage or storage. As we mentioned, the urine passes in the ureter, but it has no function or unknown function, and the kidneys and the bladder acts as a storage. And the urethra, it is the thing that discharges the urine. This is the kidneys, this is suprarenal gland, which is the aorta, and this is the renal, left and right renal artery, left and right renal vein. This is the ureter here, and nerve that is the brain. This is the nerve that tells the brain that in the bladder is full, so I have to contract and I have to urinate right now, and the nerve that tells the bladder to open. Okay, this is the urethra from which the urine is discharged. When I say nephro or renal, it means kidney. When I say hydro, it means water. So hydronephrosis, it is dilatation of the ureter due to abnormal condition involving backup of the urine into the kidneys. Okay. Cysto means bladder, cystitis, cystectomy. Bile means renal, collecting duct. When I say pyelonephritis, it means inflammation of the kidneys collecting duct. Okay. Uro or urea, it means urine. Like hematuria, anuria, nocturia, frequent getting up and urinate. Hematuria, it is blood in urine. Anuria, it is no urine at all. Nocturia, it is urine at night. Oliguria, oligo means small or scanty. So oliguria, it means low amount of the urine. Polyuria, it means that multiple urination. Urethritis, inflammation of the urethra, which is, and renal calculi, it is the stones of the kidneys. Ureteric stenosis, it means that there is in the ureter there is narrowing. Stone ureter and stone bladder. Enuresis, it means the release of the urine, most often reference to bedwetting. Okay, let's recap it. Abnormal frequent urination with increased urine volume, it is polyuria. Okay, oliguria means scanty amount, anuria means no urine, enuresis, it means bedwetting. Okay, kidney inflammation is termed to nephritis. As hydronephrosis, this is abnormal collection of the water. Renal stone, it is calculi, and cystitis, it is inflammation of the bladder. Specialist disease in the kidney is called nephrologist, gastroenterologist in the stomach, and proctologist in the rectum, and serologist in the serum. Presence of the blood in the urine is called hematuria, while vomiting of the blood, it is hematemesis. Polyuria, it is multiple amount of urine. Medina, it is black stool due to the GI tract bleeding, and we will talk about it. Upper GIT tract bleeding, we will talk about it after. Okay. The term of scanty, it means oligo. Pruriuria is a procedure allow physician to look at the bladder and examine the interior term is the bladder and the interior. It is cystoscopy. Surgical removal of the kidneys, it term nephrectomy. Hysterectomy, it is uterus. Appendectomy, it is appendix. Nephrobexy, it means fixation of the kidneys. Absence of the urine formation is termed anuria. I hope you could benefit from this video. Don't forget to like the video and subscribe the channel. Thank you.